So I started with the urology team in 2012, so nearly 2 years now. I moved here from Louisiana, and I'm originally from Baton Rouge. I went to LSU both for undergrad and got a master's degree in microbiology there. Did some very interesting work with NASA, but after graduating with my master's at LSU, moved on to a research project at Vanderbilt University. And it was there that I realized that I needed a little bit more interaction with people, and I didn't get that fulfillment with microbiology. So I decided to pursue a master's degree in medicine and went to a school, it's called Tribeca University. It's a great program right there in Nashville. I chose urology early on in my PA program. We were able to choose a specialty field that we were most passionate in, that we could train exclusively in, and I chose urology at that time. I am passionate about urology just because my family, mother, father, they've had urinary issues and sought urologic care for that, as well as myself. And I feel like when you're familiar with something and you identify with something, you're able to grasp it. So when you gain knowledge, you retain it. It makes sense. And so I've always loved urology. It made sense to me. I feel really blessed to be part of Urology Team now because female urology is what I love most, and I'm able to practice that mostly here. A PA basically has a very close relationship with their supervising physician, and they're able to collaborate care, and they're able to see the patient for overall better patient care, more thorough patient care. So here at the Urology Team, my primary focus is on female urinary health. I see men as well, but primarily female, and mostly the bladder. We deal with kidney stones, but bladder issues specifically, whether that be overactivity in the bathroom all day, whether that be underactivity, whether it's difficult to avoid, whether that be incontinence, whether that be urinary tract infections, or even bladder symptoms that may not be infectious, but more on the inflammatory level. So I see a scope of that, a whole slew of issues, primarily female. And here at Urology Team, we do something called interstim therapy, and I manage those patients. Interstim therapy, to go into a little background on that, is a way to modulate the nerve or stimulate the sacral nerve, which is the nerve that innervates the bladder, and restore it to where it's not so overactive, or whether it's not underactive. So we actually restore function to that nerve, and I'm able to manage those patients, help them learn about their device, and even do an in-office procedure to see whether they're a good candidate for interstim. So that's easy. Hands down, practice philosophy is to give the care that I would want for myself or close family members. When I want to be able to establish a relationship with the patient where they feel that they can tell me things that may be embarrassing to them. Because in urinary health or urology, we see things that are embarrassing. So I want people to feel comfortable. To give that care that I would want for myself or my family members is to give explanations as well. And so that people are a part of their treatment and not just so much doing what someone recommended.